I'm Dr. Richard Ayres, and I'm making a short video about why I got into global health and why it interests me. It started, I suppose, my interest, I took a year out between school and uni, and I travelled around Africa for several months, and that kind of opened my eyes, I guess, a bit, having grown up in London. And then when I went to medical school, I went to Edinburgh, and I was lucky that we got, in those days, 4 months, 16 weeks of electives. So I did my elective in Kenya and Uganda and did lots of work with primary healthcare and leprosy work, which interested me for some reason, and actually partly funded my elective from a lepra essay prize that I competed in about chemotherapy for leprosy. And so I kind of had an interest, kept in touch with people that I'd met in Uganda through my GP training. I went into that because I was interested in primary healthcare and the health for all stuff. And then for various reasons, I went back to Uganda to help out for a bit. Somebody I'd kept in touch with, and ended up staying there for 8 years and working, setting up primary healthcare projects and a lot more leprosy work, as well as general hospital stuff. So that fairly defined my career for quite a long time. And then eventually I came back to this country, back into general practice, but to have kept very much a kind of primary healthcare and global health focus. Got into academia pretty quickly, I'd done a lot of teaching all my career. Now work in the medical school in Plymouth. I'm lead for population health, which interests me greatly. My clinical work is in Devonport, which is the most health-deprived community in the southwest, and I try and link up primary healthcare ideas with the kind of academic side of things, and have a lot of students out there. And some of the principles of primary healthcare, which applied in Uganda and various things I was doing there, apply kind of equally in Devonport, but in slightly different ways. And I've been involved academically in working on learning outcomes for global health, which have been published, and we're trying to get into our curriculum here, and also stuff around, so we've got learning outcomes for health inequalities that I've worked on through the Royal College of GPs, and those have been published because working with deprived communities is quite different, and I think there's sets of skills that medics need which they don't necessarily have. And the final thing is it links up with sustainability. So it's the biggest challenge to global health is probably climate change, so I'm working a lot around trying to get more global health stroke sustainability, and that's helped by the fact that we now have the sustainability, the Millennium Development Goals, and now the Sustainable Development Goals, and that's kind of a framework that we use. So that's a little journey into global health. Fantastically interesting part of medicine, and I would commend it to anyone going into that subject. Bye for now.
It wasn't accidental.